We use medications in heart failure both to make symptoms better but also improve survival with heart failure.
When a patient comes with a heart failure, the first medication we always put on board is a beta blocker. A beta blocker is very important. Why? It lowers the heart rate and therefore forcing your heart muscle to get stronger. So a beta blocker is our #1 medication.
Angiotensin receptor blockers, or ACE inhibitors, are used to relax the blood vessels, to decrease blood pressure, and increase the amount of blood that's getting pumped forward to the body.
So there's a new medication now. It's the first medication that is shown to decrease mortality in patients with systolic heart failure. That is a combination of valsartan and sacubitril. Valsartan is a relative of an ACE inhibitor. Sacubitril is a brand new class of medications, and it's actually a hormone that's released by the top of your heart to help patients unload the pressures of their heart, almost like a diuretic.
Diuretics have never been proven to increase survival in heart failure, but they certainly can make patients feel better. They do that by increasing the amount that a patient urinates. So if more urine goes through the kidney, you're decreasing the level of fluid in the body, and it eliminates the fluid retention that a lot of patients with heart failure experience. We also use aldosterone antagonists, which work by blocking one of the receptors in the body that generally in a heart failure state can cause fluid retention and scarring and arrhythmia.
Now, in a set class of patients, particularly African Americans, they may benefit from a combination pill, which is hydralazine and nitrates. And it's very important that if you are African American, that you be started on these additional medications, because we have multiple studies out there that has shown that it not only improves overall pumping of the heart, but it also reduces your risk of death, for example.
Another option for some people with heart failure is SGLT2 inhibitors. This class of medication may be especially helpful for people who also have type 2 diabetes.
It's so critically important to survival for that patient to be taking the medications, to be following up, to be very mindful of their lifestyle modifications.
I think people think of heart failure as a condition where it's doom and gloom and you're just going to be bedridden. And that's not the way it is anymore, because we have multiple medications that can work to improve symptoms and in some cases improve heart muscle function.